Hello students, this is Dr. Ways and welcome to your lecture on the anteromedial thigh. As far as the fascia is concerned, there's nothing new on this that we didn't go over with the posterior compartment of the thigh. And so the only new thing I want to mention is the superior border of the fascia lata, which is the inguinal ligament here. And of course then it's going to go all the way around the backside in the iliac crest and continue down laterally, medially, and anteriorly. So again, it's like a giant stocking of connective tissue that surrounds your entire leg. So looking at this picture again, we have the anterior part of the thigh here, posterior back here. We've already covered the posterior compartment of the thigh, so now we want to do two more compartments in this lecture, which is the anterior compartment as well as the medial compartment, together known as the anteromedial thigh compartments. All right, even though we're considering them one, if you look, they are separated by an intermuscular septum, so they are also two separate compartments. So there's nothing magical about why we're calling it the anteromedial, it's just covering them both at the same time. So the anterior compartment specifically, those will be our leg extensors or knee extensors. So when we contract those muscles, our knee will go into extension. And then the medial compartment then will be our adductors, So they will adduct our thigh, add it back to the midline of the body. Notice that the anterior compartment spreads into the lateral aspect of the leg, and so there's not a separate discrete lateral compartment. The anterior compartment simply extends into the lateral part of the thigh. All right, so we'll start with the anterior thigh muscles, and those will be outlined right here in gray. They are collectively going to be called our quadriceps, or our quadricep muscles, okay, because there are four. We have the vastus lateralis, which will make up our lateral aspect of the thigh. We have our rectus femoris, which will go right up the center of the thigh, superficially. And then we'll have our vastus medialis, which will make up the medial part of the anterior thigh. Then if we take away the rectus femoris and look underneath, what we'll have is our vastus intermedius, and that's because it's intermediate between all three of the other muscles that we just mentioned. The other one that we're going to go over is going to be the sartorius muscle, which is a thin band of muscle that runs from medial to lateral, so the medial aspect of the knee to the lateral aspect of the hip, and it's going to cross over the vastus medialis as well as the rectus femoris. So I apologize for this slide and in your notes because it is a little bit blurry, but I pulled these directly from your bare bones book, so if you can't read them clearly here, please refer to your bare bones workbook on page 426. All right, so we'll start with our most superficial muscles, and the most superficial would be, of course, the sartorius right here, running at a diagonal along the leg here. We talked about that. It is its origin is here at the anterior superior iliac spine, and its insertion here is at this place we call the pes anserinus. And you'll notice that, let me erase a little bit here. You'll notice that there are several muscles that will connect in this spot along with the sartorius muscle. And so the sartorius muscle, since it goes at this oblique angle, it's going to have several functions. So if you think of it contracting, it's going to flex the thigh at the hip joint, so be involved in hip flexion. Abduction of the thigh at the hip joint, because it's going to move the thigh away. lateral rotation of the thigh at the hip joint. So if you pull on the medial aspect of the knee, your thigh is going to turn that way. And flexion of the knee at the knee joint. So it is attached here. So when it pulls, there's going to be a slight flexion, although this is not going to be one of your major knee flexors. All right, and the nerve that supplies it is the femoral nerve. All right, for the rest of the quadricep muscles, basically they all do the same thing, and the main function is extension of the leg at the knee joint. So extension of that lower leg at the knee joint. But they also can participate in some flexion of the thigh at the hip joint as well. And then notice this trend that the rectus femoris, which is the one we're specifically talking about here, is innervated by the femoral nerve. So we can practice this in a lab or practice at home. If you find your anterior superior iliac spine and then go just inferior to that and then start lifting your leg, or lifting your thigh rather, up, you will actually feel that muscle tighten up. And so that is showing you that the action of flexion of your thigh at the hip joint. All right, vastus lateralis, vastus medialis. Of course, this is the rectus femoris we did in the previous slide. Vastus lateralis over here, vastus medialis over here. Again, pretty much the same thing, extension of the leg at the knee joint that we saw previously. And with the rectus femoris, and both innervated by the femoral nerve. And then the vastus intermedius, so if we take this rectus femoris away and look underneath, we'll have this smaller muscle called the vastus intermedius because it's in between all of the other ones. And it's, again, going to extend the leg at the knee joint and, again, be innervated by the femoral nerve. All right, so we're going to add two more muscles to this that weren't in the actual thigh, but are more in the hip, or the pelvic region, rather. So collectively, we refer to them as the iliopsoas muscle. And separately, they're the iliacus and the psoas major. And we talked about these earlier when we talked about the pelvic region and the abdominal region. But we want to give a function here. The iliacus, which is this one right here, notice it's going along the ilius, hence its name, iliacus. Go downward and then insert into the medial aspect of the femur at the lesser trochanter. And so in doing so, what it's going to do is flex the thigh when the hip is fixed. So what this means is if you're standing straight up, right, in anatomical position, and you raise your thigh, that's flexion of the thigh with the hip being fixed. Primary flexor of the hip when the thigh is fixed, you stand in anatomical position and then bend over at the hip, bend your trunk over. That would be this action right here. So again, supplied by the femoral nerve. And then the psoas major, notice it goes from thoracic vertebrae 12 all the way down to lumbar vertebrae 5 as its origin, and then the insertion point is the lesser trochanter of the femur. So it's going to have the same actions that the iliacus does, which is why they're considered as one muscle sometimes, the iliopsoas. So in your physical exam lab, there will be a maneuver that you do called the iliopsoas maneuver. And these are the ones you're activating when you do that. Since the iliacus, since the psoas major is a little bit more superior along the vertebrae, its innervation is going to be a little bit different than the femoral nerve we saw with the rest of these thigh flexor and knee extensor muscles. And they're going to come from the ventral rami of L2 through L4. All right, and those are going to go to the psoas major and cause it to contract, which will also tell you that these two muscles, although considered one muscle sometimes, can act independently from one another. All right, so now we'll move to our medial thigh muscles, and we're going to go from most medial to most lateral. All right, so starting here with the gracilis will be this long muscle right here that goes from your inferior ramus of the pubis, so that, excuse me, rounded part right there, all the way down to the pes anserinus of the tibia. All right, so it is going to be involved in adduction. Of course, anything medial is going to adduct the thigh at the hip joint. It can do some flexion of the thigh at the hip joint and some medial rotation of the knee, and that has more to do with where it is located on the insertion point of the knee. So I lied. We're not going to completely go from medial to lateral. The next muscle you see here is the pectineus. So the pectineus is this small muscle right here that's going from the pubis to the femur, to the medial aspect of the femur. And of course, seeing that adduction of the thigh at the hip joint, which is its major action, but then it can also provide some flexion of the thigh at the hip joint. So the adductor muscles, when they flex the thigh at the hip joint, would be accessory muscles to what you would see with the muscles of the anterior compartment of the thigh. All right, and of the ones we're covering on this slide, this is the only one that's innervated by the femoral nerve. The other two, the gracilis that we just talked about, and the adductor longus, which is between the gracilis and the pectineus, that would be innervated by, those were both innervated by the anterior branch of the obturator nerve. All right, and again, being an adductor, the adductor longus, and notice that it is long and thin, and we're going to compare that to the adductor magnus in the next slide, involved in adduction of the thigh at the hip joint, and again, flexion of the thigh at the hip joint. All right, continuing on, if you look between the pectineus muscle and the adductor longus, you'll see the adductor brevis. Brevis usually means short, so this is going to be a shorter muscle. And again, adduction of the thigh, flexion of the thigh at the hip joint because it's still relatively anterior. And like the gracilis and adductor longus, it's going to be innervated by the anterior branch of the obturator nerve. All right, the big muscle that we've mentioned a few times, but here we will go into the details of it, the adductor magnus. And we're going to show this in a better picture on the next slide. But the adductor magnus is one muscle, but it has two parts that act independently of one another. All right, and each of those parts, notice, has its own origin, own insertion, own action, and own innervation. So, and then one is also within the medial compartment, and then the other one is within the posterior compartment. So the adductor part, which is what we're concerned about right here, is this big fan shape that starts, originates in the ischiopubic ramus. So this line right here, I'll show it on this side, but then spans the entire length of the femur along the linea aspera. All right, so that linea aspera would be one of those things you want to find in the bones in the lab. So it runs the entire length of that, so it's big fan shape. That's why we call it the magnus, because it's so big. And its job, again, is going to be to adduct the thigh, and it's going to flex the thigh at the hip joint. So, or help flex the thigh at the hip joint. All right, still innervated by the obturator nerve, but instead of the anterior branch, like the three muscles we mentioned before, this is innervated by the posterior branch of the obturator nerve. All right, then the extensor part will be attached to the ischial tuberosity, so that bump back here along the ischium. Insert into the adductor tubercle within the femur and help with extension of the thigh at the hip joint. So it's going to either bring our leg back down to anatomical position, standing straight up, or it's going to help hyperextend our thigh. All right, and its innervation is going to be the tibial part of the sciatic nerve. So notice that sciatic nerve served all of the posterior compartment muscles, and so it's also going to serve this extensor part of the adductor magnus. So just to show you these muscles again and compare them to one another, so here's our pectineus, here is our adductor longus, and notice it's long shape, as opposed to the adductor magnus, which is also long, but it's also very broad. So since it has this long, broad structure, and it lies underneath here, the adductor brevis, that's why we call it the magnus, meaning big. All right, so this would be long and rope-like. The adductor magnus would be long and fan-like. All right, and then the adductor brevis sitting just anterior to the adductor magnus. All right, so in this slide we see the nerves and where they're coming from. So remember, the obturator nerve is coming from L2, L3, and L4 ventral rami, and then divides into our posterior branch right here and our anterior branch right here. And remember that the anterior branch innervates the gracilis, the adductor longus, which has been cut here, and the adductor brevis, whereas the posterior branch, remember the adductor magnus is deep or posterior to these muscles that we just mentioned. So it makes sense that the posterior branch of the obturator nerve would go to the adductor magnus, the adductor part of it. And then here we have the femoral nerve coming down, which, remember, supplies all of the muscles of the anterior compartment, including the iliacus, but not the psoas major. That comes from lumbar vertebrae 2 to lumbar vertebrae 4. And the femoral nerve also supplies the pectineus muscle here. And we'll keep it simple here with the anteromedial thigh. Just know that the femoral artery will supply almost all of those muscles with arterial blood. So now we'll go a little bit deeper into that femoral triangle here. Remember, the femoral triangle is bordered superiorly by the inguinal ligament, medially by the gracilis muscle here, and then laterally by the sartorius. And then as it goes under the sartorius muscle, it will form this potential space called the adductor canal that has a tube-like appearance through which blood vessels and nerves are going to run through, and then it's going to go from anterior part of the thigh to the posterior part of the thigh through this little hole within the adductor magnus called the adductor hiatus. And what passes from the adductor canal through the adductor hiatus is going to be the femoral artery, where it will then become the popliteal artery, and the popliteal vein, which will course upward to become the femoral vein. Some important landmarks that are at the superior border of the femoral triangle include this structure here called the femoral canal. And notice that what's in the femoral canal is the femoral artery as well as the femoral vein and some lymphatic. The femoral canal will end here with the femoral sheath, And then notice the hole here in the fascia lata, which is just superficial to that femoral sheath, where the great saphenous opening is for the great saphenous vein to come through. All right, so all that's occurring within the femoral triangle. And then notice laterally, you have the femoral nerve coursing outside of the femoral canal. All right, looking at the triangle a little more closely, and I think we might have mentioned this before, but I will mention it again because it's important to know. You have the nerve, artery, and vein going from lateral to medial. Nerve, artery, vein, and then lymphatic. So again, navel, going from lateral to medial. Nerve, artery, vein, lymphatics. Specifically, femoral nerve, femoral artery, femoral vein, inguinal lymph nodes. Specifically, deep inguinal lymph nodes. Those you cannot palpate.